As a child care provider, you are responsible for acting quickly, staying calm, and ensuring the well being of every child in your care. And the same goes for all of your staff. In child care settings, minor bumps and scrapes are just part of everyday life. But what happens when a more serious emergency arises, an allergic reaction, or a severe asthma attack, or sudden illness? In this module, we'll walk you through some common medical emergencies in childcare settings and provide specific practical steps you can take to respond effectively. One of the most serious emergencies that you can face is a severe allergic reaction, also known as anaphylaxis. It can occur within minutes or up to an hour of exposure to any allergen, such as certain foods, insect stings, or medications. Every child care provider should know how to use an epinephrine autoinjector and be familiar with each child's allergy management plan. Another real common emergency is an asthma attack. If a child in your care has asthma, ensure you have an up to date asthma action plan and know where their inhaler or nebulizer is stored. Other emergencies may involve injuries like cuts, head injuries, or broken bones. Knowing basic first aid, how to stop bleeding, stabilize an injury, and when to call for emergency help is crucial. Any medical emergency, your first task is to stay calm. Children will look to you and your staff for reassurance. So, your ability to project confidence can reduce their panic and keep things under control. Follow these key steps when handling any emergency. First, assess the situation. Determine the severity of the emergency. Call 911 if necessary. Administer first aid or emergency medication as needed. Notify the parents as soon as possible based on your SOPs. Document the incident thoroughly for your records and follow up. By being prepared in advance, staying informed, and practicing regularly, you can ensure that your childcare center is ready to handle any medical emergency with confidence. Let's move on to the next section where we'll review how to create and update emergency medical plans for your center.